Hello, everyone. I'm Katie Zaffel, Marketing and Communications Director for Rogers Behavioral Health. Thanks for joining us here today for our Facebook Live Q&A. Today we have with us Rogers Dr. Rachel Leonard and Dr. Sim Yin Tan. They'll be discussing the signs and symptoms of depression and what treatment looks like. If you have any questions for our experts, please post them in the comment section below and we'll do our best to answer them at the end. Dr. Leonard and Dr. Tan, thank you for being here.
Thank you so much for having me here today. I'm so excited to discuss this important topic. As we have seen the pandemic continue, we have noticed a secondary crisis of mental health with rates of depression, anxiety, and addiction on the rise. We also know that many people struggle to talk openly about symptoms of mental health disorders or to seek help because of shame and stigma that have persisted. And so hopefully through conversations such as this one, we can work to counteract that and provide some helpful information to those who need it.
Good afternoon, everybody. Thank you for having me here as well. I will echo what Dr. Leonard had said regarding the importance of this discussion. This past year with the pandemic has had a major impact on all of our lives, and not surprisingly, we're seeing an increase in depression rates. And while depression is not a new topic, it is one that is worth the ongoing conversation so we can continue to increase awareness and educate others about what to look out for in terms of symptoms as well as treatment.
Great, thank you both so much. Let's get started with some questions. Dr. Leonard, with depression being the leading cause of disability for people ages 15 to 44 today, can you tell us more about what depression is and explain why it's more than just the blues?
Sure. So depression is interesting because there's a host of symptoms that can make up the disorder, and some of them are actually opposites. So with depression, one of two core symptoms needs to be present for the diagnosis to be made. That is either depressed mood most of the day, nearly every day, or a loss of interest or pleasure experienced in activities that used to be enjoyable for people. If one or both of those symptoms are present, then having a total of 5 or more symptoms leads to that diagnosis. Some of those other symptoms include changes in weight or appetite. We see either increased appetite and weight gain, or sometimes significantly reduced appetite and weight loss. Similarly, there's often some changes in sleep. Oftentimes this might be hypersomnia or people feeling much more tired and sleeping much more than they did before. But sometimes people with depression really struggle to fall asleep or stay asleep and experience significant decreases. Despite sometimes that increase in sleep that individuals are getting, there's often still this sense of fatigue and lack of energy that comes along with depression. Similarly, often you can kind of tell if someone's depressed just by how they're speaking, how they're moving. Some individuals with depression have a noticeably slowed movement, physical movement, speech, and also report some kind of fogginess in their thought, where they're reporting a slowing of their thought process as well. And that can also relate to difficulties in concentrating. It can often be really challenging for individuals with depression to make decisions. There's more doubt and challenges there. And then one of the most concerning symptoms of depression is thoughts of death or suicide. And of course, we always need to be taking that very seriously. With these symptoms, to have a diagnosis made, there needs to be significant distress experienced by the individual or significant impairment. We often see that their work or school life is impacted, their relationships are impacted, sometimes their ability to take care of themselves and their living space can be impaired as well. And this is really different from the blues. All of us will experience normal sadness at times, and that is to be expected. It shouldn't be avoided. That's a natural part of life as we experience different things in our lives. And certainly with the pandemic, we might have been experiencing that more often. Depression is a more severe, persistent mix of these different symptoms that really leads to that impairment in functioning, that significant distress, and is separate from those transient feelings of sadness. And so really this is a serious diagnosable disorder that really does require and benefit from intervention.
All right, thank you. What are some common types of depression?
Sure. So what I just described was major depressive disorder, which is the one that we most frequently see, but there are many different mood disorders out there. There's persistent depressive disorder, which is kind of similar to what used to be called dysthymia, which could be kind of a lower grade or more chronic depression. This could also capture the symptoms I just mentioned that last for a much longer period of time. So if those symptoms are going on for 2 or more years in adults or 1 or more years in children and adolescents, then that would instead be characterized as this persistent depressive disorder. Other mood disorders include bipolar disorder, premenstrual dysphoric disorder, and disruptive mood dysregulation disorder, which is a newer diagnosis specific to children and adolescents.
Okay, great. Thank you very much for helping us learn more about that. In addition, are there myths out there that you think have contributed to the stigma surrounding depression that you'd like to help debunk today?
Sure. I mean, I think we're all hoping that some of these myths are improving over time as we have more conversations like this one, have more public figures speak out about their own struggles with mental health. But unfortunately, I do think some of these myths have persisted. One of them that I find the most concerning is that individuals sometimes view depression or mental illness as a sign of weakness and may keep quiet about what they're experiencing, think that they should be able to manage it on their own and not seek treatment as a result. So, I personally, and I know many other people feel this way, see open conversations about symptoms and treatment seeking as a sign of courage, as a sign of strength. So hopefully we can help normalize more of that over time. Also, something that can really interfere with the treatment process is a sense that there must be a very specific and identifiable reason for being depressed or for struggling with mental illness, and that to get better, they need to figure out what that reason is. And this can actually contribute to something called rumination, which is this process of kind of thinking over and over again about symptoms, reasons for being depressed, kind of why is this happening to me? Will it ever get better? And that actually can make depression much worse over time and can keep people from doing the things that might lead to them feeling better. Finally, I think sometimes the typical perception in the media or the general population of someone with depression is that they're very tearful and kind of clearly and noticeably sad. And that might happen for some people with depression some of the times, but it can look very different in different individuals. Sometimes there's more kind of irritability and anger that comes along with depression. Sometimes there's more of a sense of apathy, people who can't cry because they're so depressed or who don't really connect with any emotions. And so I think only noticing the tearfulness can often lead people to not kind of reach out and ask about some of those other symptoms when they're coming up too.
Thank you, Dr. Leonard. Do you feel that, or do you ever see that, an effort for people to kind of try to mask their depression, that maybe sometimes they often will seem maybe overly joyful or happy just to try to kind of hide that feeling of depression on the inside?
Absolutely. And that's something we talk about often in treatment as well. How do we open up and be vulnerable and still kind of take steps needed in treatment to get better? And so sometimes individuals do everything they can to hide their symptoms, to act normal. And then the second they're home or away from their responsibilities, it kind of crumbles. And so they might seem okay at work or at school or with friends and family. And then once they're on their own, they're spending the whole evening in bed, or they're really struggling to get anything else done because that can be so taxing and challenging for people.
Mm-hmm. Okay, thank you. Dr. Tan, what are some simple things people can do at home to kind of help ward off depression symptoms?
Yeah, I would say start focusing just on the basics of self-care, and this includes taking care of your hygiene, eating well, sleeping well, keeping yourself active, and if possible, create a simple daily routine to just help anchor your day. And as you're scheduling your daily to-do tasks, make sure to schedule breaks as well to engage in something enjoyable or just some sort of a physical movement. And I would say take a moment to just reflect on the day and focus on the positive things, things that you're grateful for, small accomplishments, things like that, to just help you stay grounded. And find opportunities and also make effort to connect with other people socially to strengthen your support system. And if you're struggling, talk to somebody about it.
Thank you. So taking a look, how would depression possibly look different between age groups? Dr. Leonard, could you share how it may look in adults?
Sure. I think, this is a bit of a challenging question, actually, because as I mentioned, there are so many different symptoms and combinations and presentations of those symptoms that can lead to depression. So in younger adults, you might see more irritability than in older adults, but it's very possible to have one adult struggling with depression who is sleeping 12 hours a day, eating more, has gained weight, is reporting fatigue. And you might have someone else who's equally depressed, who is suffering from insomnia, who has lost their appetite, has lost a significant amount of weight. And both of them, are diagnosed with depression. So I think that is one of the complicating things about depression, is that it looks so different in different people that can make it tough to recognize in any one individual. But I do think, the developmental difference can be some more of that irritability in the young adults. With older adults, sometimes you see more of the cognitive deficits too, so more challenges with the concentration, decision making, and those kinds of things.
Thank you. And Dr. Tan, how might depression look in children and teens?
Yeah, among kids and teens, we typically see an increase in irritability and anger, where they might get easily bothered by small things, and they can also be extremely critical of themselves. So you see them engage in a lot of negative self-talk, and they can also present with low self-confidence and just lack of hope for their future. And for younger kids, they may show more clingy type behaviors, frequent crying, tearfulness, or temper tantrums. And in some kids and teens, if the temper tantrums and the anger outbursts become so severe, they might even meet criteria for a diagnosis that Dr. Leonard mentioned earlier, the disruptive mood dysregulation disorder. And for others, the depression symptoms may show up as noncompliance and oppositional behaviors, or an increase of physical complaints such as headaches, feeling nauseous, or stomach ache. And this is because kids and teens, they may not have the ability to fully understand or even express how they're feeling. And in addition to that, we may also see changes in a variety of behaviors, such as neglecting their self-care and appearance. They may be sleeping too much, missing school. Their grades might be declining. They might avoid daily tasks such as homework or chores. We also see them starting to withdraw and isolate from family and peers and things that they used to enjoy, like sports and music. We see that teens who are depressed are also at a higher risk than the general population to develop substance use problems. And they're also at a higher risk for self-harm and suicidal behaviors as well.
Mm-hmm. Thank you. For younger kids, is there an age where the symptoms might become more severe, or that that depression might be a diagnosis? Is there a certain age where you see that happening more?
Yeah, we see depression happening as young as preschoolers, but typically we tend to see more of the severe symptoms in adolescent or the teenage age, just because there's so many social academic demands, and they're trying to figure out who they are as a person. So we tend to see an increased rate in depression for adolescent and teenagers.
Mm-hmm.
And And I think that's interesting. I don't know if that's I think it probably is both a true difference in rate, but also the ability to detect and communicate what they're experiencing is different as children get older. As what we've seen just anecdotally in our clinic is with the younger children, they're more likely to get into treatment for something else. So they're coming in for anxiety, they're coming in for non-compliance or outbursts or those kinds of things. And then after some more digging, we might discover that they're depressed. But I think it's something that parents and educators maybe struggle to identify in the younger children.
Yeah, thank you. I would think too, for young children, some temper tantrums or crying, it might be hard to kind of distinguish when to know when it's something to be concerned about, that it may be signs of depression, and when it's, a typical 4-year-old behavior or something. So thank you for that clarification. And then sadly, recent studies have shown that unfortunately someone dies by suicide every 12 minutes today. Knowing that depression is often a primary cause for this, Dr. Leonard, could you shed light on what someone should do if they themselves have thoughts of suicide, or if a loved one expresses suicidal thoughts?
Sure. Yeah, this is unfortunately a more important topic of conversation than ever. This is another kind of aspect related to the pandemic that we've unfortunately seen on the rise. So there are some things that we can do to support loved ones who might be experiencing suicidal thoughts, and things that you can do if you're experiencing suicidal thoughts as well. So the first thing I would recommend is that if someone mentions thoughts of suicide, that you have an open and direct conversation about that. There's been a myth about suicide that talking about it, or the more we talk about it, the more likely it might be to happen, the more likely someone might be to attempt suicide, and that is not true. So actually talking about it more and getting more information and having these conversations can be really important for preventing suicide. So in those open conversations, it's very helpful to ask direct questions. So how often are they thinking about this? Have they taken any steps? Do they have in mind a specific plan? Do they have access to that plan? Getting that information can be very helpful in determining what they might need in the moment. If you think a loved one's struggling and you don't feel comfortable asking those questions, it's always a good idea to recommend that they get help. If they're in treatment already, talking with that person is a good step. If it seems more serious or severe or imminent than that, then we always recommend calling 911, taking them into the ER or an inpatient psychiatric facility. And if you're somebody who you know this person really well, we like to be scientific and base decisions off of very clear criteria, but especially with suicide, there's something to be said for your own sense of how this person is doing and your own judgment. And so if something feels really off, if you think that they're struggling and they haven't sought help, then that's really important to pay attention to as well. The other things that loved ones can do is, if you know someone's struggling with this, take steps. If you live with them, especially, take steps to make the house a little safer. So if you have a firearm in the home, if you have different things that could be used for suicide, then making sure that that person doesn't have access to those, at least during the time temporarily while they're struggling with these thoughts. And then, finally, I think I do this all the time too, where somebody comes to me with an issue or a problem, and I want to solve it for them. So I want to start suggesting things they can do. But especially in conversations about suicide, it's important to not just do that, but to also really empathize and validate that you hear them. Like, I understand what you're saying. I'm sorry you're going through this. This sounds like a really challenging time, and I'm here to help you. I'm here to support you. There is hope. Let's work on this together and make sure that you have the support that you need.
Yeah, thank you so much for that. I know there are probably a lot of people out there listening that may have faced situations like this in their own life and may be scared and feeling, powerless and not knowing what to do. And I think your words about opening the conversation and how that's a helpful thing and a positive thing, I think is just going to be extremely helpful for a lot of people listening out there. So thank you very much.
Of course. I do want to mention too that there are a number of hotlines that can be called, and I think for teens, for even a lot of adults, there are some text lines. So if people are uncomfortable making a phone call, there are some options to use text or other means to reach out for help.
Thank you. And I think one other wonderful thing about opening up these conversations, especially now, is that it also opens up the conversation about treatment that's available. Dr. Tan, can you talk us through what treatment for depression looks like and what are some of the key components of treatment are at different ages?
Sure. So cognitive behavioral therapy, or CBT, approaches are considered the gold standard for treatment for depression. So the idea behind CBT model is that our thoughts, feelings, and behaviors, they're all interrelated and they can affect one another. And a lot of times when individuals come to us for treatment, their main goal is they want to feel better. They want to feel less sad. They want to be happier. The thing is, there's not a direct way for us to change feelings, but we can influence feelings by modifying behaviors. So one specific CBT approach, known as behavioral activation, is a well-established and evidence-based treatment that primarily targets behavioral change in ways to help people not only improve their mood, but change their negative thinking patterns. And if we think about, all the life circumstances that we go through, just like the pandemic, when we experience things like that, it is expected, for individuals to experience some sort of an emotional response, whether it's feeling sad, depressed, or hopeless. And when individuals are depressed, they tend to avoid, isolate, they might withdraw from their daily lives, and just in general become less active overall. While these behaviors can make sense because of the circumstances, they can actually reinforce the depression cycle over time. When individuals avoid life, two main things happen. One, they really missed out on opportunities for positive and rewarding experience that can help elevate their mood. And two, when they avoid, that avoidance can then cause new problems, which can make the depression worse. So the goal for behavioral activation is to help individuals break out of this cycle. And we do that by helping them identify patterns of their avoidance behaviors and then purposefully identify some targeted active coping activities that they can gradually engage in to help improve their mood. And the targets of activation include three main things. One, routine activities, so things that we do on a daily basis to take care of ourselves, like hygiene, because we know that when individuals are depressed, that's the one thing that they tend to neglect. And then two, enjoyable activities, so things that gives us joy and pleasure, such as engaging in a hobby. And three, valuable activities, so things that are important or bring meaning to our lives. And this could be things like spending time with family, participating in school, going to work, or any other activities that may help promote personal growth and mastery. In addition to the behavioral activation, treatment for depression also includes skills coaching and practice. So some example of the skills that we do teach individuals in treatment include mindfulness skills, distress tolerance skills, emotional regulation skills, social, interpersonal, or communication skills, goal setting, problem solving, and so on. And in terms of the key components that we look for in a treatment is, the biggest thing is there's that psychoeducation piece on depression, because we want people to understand what depression is, how it's being maintained, and what you can do about it. We want people to start tracking their behavior and their activity, monitor their mood, and in cases where they might have safety concerns, we want to work with them with safety planning as well. And then the behavioral activation piece is still a huge piece. So, some activities scheduling there, and then skill practice reinforcement. And then typically at the end of treatment, we help individuals come up with a relapse prevention plan to help them to maintain their progress. In terms of treatment with kids and teens, I would say parent education and the parent involvement piece are the key. And for several reasons, a lot of times when kids and teens come to treatment, it's not because they want to be there. They're there because, their parents brought them to treatment or because you're recommended by like a school personnel. So we want parents there to be able to help motivate and reinforce some of the things that we're teaching them and help with the skill generalization piece outside of treatment. And I think secondly, too, we're giving parents some education on what to do, how they can be supportive, because there are times when parents think that they might be helping, but some of their behaviors can actually accommodate the child's maladaptive behaviors. And lastly, for those who need more than just therapy alone, they may need medication management as well to be part of their treatment plan.
Great. Thank you so much, Dr. Tan. When you talk about skills, it sounds like some of those skills, along with, parent education and involvement, are things that we could really be using at home as well. Right. Could you tell us a little bit more? You mentioned distress tolerance. What does that mean?
Yep. So, when we experience hard stressors, difficult stressors, we might experience painful emotions like feeling stress, overwhelm. So we would provide them with some skills that they can practice throughout the day to help reduce the levels of distress, because what tends to happen is when people are overwhelmed with the stress, they tend to find unhealthy ways to cope with it. And one of it could be substance use or self-harm behaviors, or even, in more severe cases, suicidal behaviors. So we're teaching them specific skills to help them learn first to accept what they're going through, their emotions, and then some skills on how to reduce the level of distress. So then they can engage in other behaviors such as problem solving and so on.
Great, thank you. All right, well, thank you so much. I know I learned a ton today listening to you, and it sounds like we have a lot of listeners who have a lot of great questions, so I'm going to jump right into a few of them. Number one, I have BPD, and I was wondering what home remedies can you mention to help, if any, or do I need medicine?
That's a good question. I can start, and Dr. Tan, feel free to jump in. But, I think whether or not someone needs medicine or they need more than kind of managing on their own depends on so many factors. So the severity, if there are safety concerns present, generally the kind of recommended treatment for BPD, and I guess I'd want to clarify there's two BPDs out there. So sometimes people talk about bipolar disorder as BPD, and sometimes people talk about borderline personality disorder as BPD. So if it's bipolar, generally the treatment will be including some sort of medication management. That does tend to be more important with bipolar disorder than with a lot of other disorders. And there's a lot of strategies that are more psychosocial in nature that can be helpful, kind of monitoring and making sure that people are kind of sticking to a strict schedule, looking for signs of mania or depression and intervening quickly. But that is one of the disorders that tends to respond more to medication. If it's borderline, then that might be not as much the case. It might depend on a whole host of different symptoms and factors related to the severity and safety concerns.
Yeah, and I would say social support will be really important for both cases, whether it's bipolar or borderline. We want to make sure that parents or siblings or significant others are helping them in the times when they're struggling to help themselves.
Great, thank you. The next question, my 8-year-old has a diagnosis of single depressive episode and self-harm. I wanted to know how I should help her or things I should watch out for. Her psychiatrist says she looks normal.
Yeah, and like we mentioned earlier too, like sometimes kids can just seem normal, but inside they may be struggling with a lot of emotions. I would say as a parent, it's just important to be present. Kind of going back to what Dr. Leonard was saying earlier, is be available to kind of listen what they have to say. Are they things that they may be struggling, and be there to validate how they're feeling. A lot of times when kids experience certain things, to us adults, it might just seem like it's a small issue or silly or irrelevant. But to them, it is a big deal. So I would encourage parents to acknowledge that, and even just a simple acknowledgement of how they're feeling can go a long way in making them feel understood and supported. And since there are some safety concerns as well, I would, kind of reiterate what Dr. Leonard had mentioned earlier in terms of monitoring and then safeguarding your environment as well, to make sure that this young child will not have any excess that might end up hurting themselves, whether it's with sharp objects or whatever it might be. So keeping in mind is that there are ways to help you safeguard the environment. And try to engage the teen as well, or the kid as well, in a variety of activities. I think a lot of times when kids are sad, they tend to retreat. So if you can encourage some connection time with other people, whether it's with you, with other family, just encourage and suggest activities that you guys can do together. And also back to what I said earlier of just focusing on the basics of eating well, sleeping well. And sometimes a lot of kids, when they get irritable, a lot of times it's because they're not getting enough sleep, or they're not eating enough, they're not moving enough. So those are things to keep in mind as well.
I'd add on to that too, that, as a mom, I know that this can be so challenging to have a child who's struggling with symptoms like depression or self-harm. And so I think often it's really helpful for parents to get their own support, either through their own social network or seeking therapy themselves, so that they can kind of manage the stress that they're going through in helping their child. I think sometimes when, especially like younger children, are reporting these kinds of symptoms, some parents can kind of personalize that or blame themselves, and then that can actually kind of take them away from being able to really support the child in those moments. And so making sure to do all the things Dr. Tan recommended, and then take time for themselves to manage how they're feeling, because that's a challenging situation for them too.
Mm-hmm. Absolutely. Thank you. Next question, is anxiety a symptom of depression?
So it's not a symptom of depression, but they're like close cousins. They tend to go together very often. There are some symptoms that overlap, and so like difficulty in concentrating, challenges making decisions, those tend to go along with a number of anxiety disorders. It's also very common for depression to come along for the ride with anything else. So, if somebody's struggling with anxiety, and that anxiety gets so severe that someone isn't able to live their life the way that they want, and that their relationships, their work, their school are impacted, then they might experience depression kind of secondarily, because they're not getting the rewarding benefit out of the activities they would normally like to do. So sometimes depression can be primary and anxiety is coming along, and other times it's the reverse, but it's very common to see them together.
Thank you. Next question. I work for a youth serving organization, and we have noticed an increase in youth with suicidal ideations and attempts. We refer out to other services very often, but can you comment on patterns you're seeing surrounding this in youth?
Yeah, and I think people have mentioned that sometimes when suicide happens in, say, a particular youth, there are concerns that it might be contagious. So, we just want to keep in mind and make sure that all youth are being educated. I think one thing to keep in mind is, we don't want to glorify suicide risks or suicide behaviors and attempt. We want to make sure that they are getting the appropriate education about what it is and what we can do to prevent. And there's a lot of good work out there about suicide prevention efforts that I think, would be important to kind of bring in as part of a curriculum, or just to increase awareness for all students, and as well as your parents, or even some of the colleagues, workers that are in that community organization.
I think too, just normalizing conversations about struggles, before, hopefully before it gets to that point where people are thinking about suicide, if we can have more open dialogue and less stigma or shame around experiencing symptoms when they're milder, and help get people the help they need at that point, then hopefully that can be preventative as well.
Thank you both. Next question, how do OCD and depression work together?
So we see a lot of that combination here at Rogers. Often we see that when OCD is severe, we see depression tends to be present as well, because OCD can kind of shrink everyone's world. So as people get kind of caught up doing more and more ritualistic behaviors or compulsive behaviors as part of their OCD, they also tend to avoid situations that might trigger the obsessions and kind of related compulsions. And that is kind of a recipe for depression. So often the good news here is that many times as we treat the OCD and the OCD gets better, the depression will get better on its own, because as the OCD gets better, individuals are able to live their lives more the way that they want and start to reintegrate into their social lives, get back at school and work and doing the things that they love. If that's not happening, then we do often need to supplement OCD treatment with kind of a separate but related depression treatment, similar to what Dr. Tan was talking about earlier. The nice thing is that our OCD treatment and our depression treatment have a lot in common, so they work really nicely together.
And I think both treatments really target the avoidance piece that we tend to see in both. When somebody's depressed, they tend to avoid. When somebody is engaging in ritualistic behaviors, they tend to avoid those triggers or situations that might trigger those behaviors. So the CBT component can address both OCD as well as depression.
Thank you. Next question, what do you do when you are dealing with both depression and anxiety and get panic attacks? On medication, that just takes the edge off. I feel like I'm getting worse, don't want to get out of bed or eat.
So I think as things are getting worse, that's a sign. I don't know the backstory here, so maybe this individual's already in adequate, great treatment, but if it's not getting better, then sometimes that's a sign that more treatment might be needed, a different treatment or a higher level of treatment, something more. But there are really good interventions that have great research base for all of these disorders. And so the treatments for panic disorder, for anxiety, and for depression do have a lot in common. It's not, that dissimilar from what we just discussed with OCD and depression. So really working to target really gradually the behaviors that the avoidance behaviors that might be happening to help it get more comfortable to integrate into their lives and gradually get out of bed, spend more time doing other things, but also to cope with the feelings of panic so that they're less scary. And to provide skills to use to counteract the panic attacks that might be separate from medication.
Thank you. Next question, in terms of self-care at home and focus on positivity, I'm wondering if there are any techniques or guiding tools to help individuals. Sometimes it might be hard to achieve calmness by oneself who has difficulty concentrating.
Yeah, so one of the skills I mentioned earlier, it's mindfulness skills, and we hear that a lot nowadays, where you want to help redirect your focus to get in the present, because a lot of times when people are going through a lot of stress, they tend to think about those stresses a lot. And to what Dr. Leonard was saying earlier, is that rumination piece. Like people would play it over and over in their head. So one of the things that we do recommend is teaching folks to be more mindful of their present, taking in their environment, and be non-judgmental. Just accept things for the way that they are. And it's easier said than done. And that's why, we do incorporate that as a skill practice and coaching, and somebody will have to practice that skill over and over again to make it more habitual. And some other things that I mentioned earlier too is focusing on accomplishment, or just practice gratitude for your day-to-day life. One of the method that I like to use is an acronym called GLAD. So G stands for what are you grateful for today? And then L would be what is something that you learn about yourself or others, and knowledge or information that you learned today. And then A is the accomplishment. So again, however small that accomplishment might be, it might be that, I brushed my teeth today, I took a shower today. So even little things like that, make sure to give yourself credit for. And then lastly, D is delighted. So what is something small that made you smile today? And I think that's a great activity for parents to do it with their kids, or just for individuals to do at the end of the day, to just reflect on how their day has been and help them move forward to the following day. So just take it one day at a time.
I think along with that, mindfulness is hard. As Dr. Tom said, it's a simple concept, but it's hard to implement. And so if you're new to it, and if you're kind of struggling with distractions at home, I've found there's a lot of free mindful meditations out there that you can find on the internet, on YouTube. There's, I think a mindfulness aspect to like yoga as well. So I think there's ways to get some guided help that kind of walk you through how to be mindful if it's something new and challenging for you. And then the other piece I would mention as well is that, even, a lot of people are working from home, their day-to-day lives have changed, and that can lead to a lack of structure. So, even if you're spending a lot of time alone at home, really kind of trying to put that structure back, like even if it doesn't matter, if other people can't tell, are you kind of taking care of dressing the way you would if you were going to work previously? Are you keeping the same schedules in terms of times that you're getting up and going to bed? Are you having that kind of structured meal time? And so really trying to stick to a schedule, even if it's not as necessary.
Thank you. And that actually was a question that we had here. Can working from home and not socializing lead to depression?
Yeah, definitely. I think, that's part of what I assume is the impact the pandemic has had on depression. So when we talk about symptoms of depression and things that can make depression worse or keep it going, there's avoidance, there's lack of interaction with loved ones, there's lack of, meaningful interaction at work. There's all of these things that we would typically recommend people do that are harder right now, and that feel different at times when it's not in person, or we've had to make adjustments. And if you're already struggling with some of these symptoms, it has become a lot easier to kind of fly under the radar, to avoid people, and to really disengage, and then that can make depression worse.
Yeah, and I think too, because of all the restrictions that are in place, it seems like it might require more effort to get to what things used to be. And again, when people are already feeling depressed, they might avoid even making that extra effort to get to that point.
Thank you. Another question that just came in, does depression look different in women versus men?
That is a good question. It can. So, with women, there might be sometimes a more hormonal aspect to depression. And so, as I mentioned, there is a specific disorder called premenstrual dysphoric disorder that can relate to those hormonal challenges. Something else that we tend to see is that women overall, of course, this is not true for everyone, but generally women are more comfortable discussing their emotions and are more likely to seek treatment. So with men, it can be a challenge to work to get that vulnerability and openness about what they are experiencing, and to even just get them in the door to treatment. And so oftentimes part of that challenge is to really normalize feelings and encourage that open conversation so that we can determine what's needed for treatment.
Thank you. And it looks like we have one final question here. We've talked a lot about treatment, and we've learned a lot about how people with depression can receive help. For those who do have a loved one in treatment, how can they support that person?
I would say, be involved as much as you can. I think with kids and teens, parents are naturally involved. But for adults, sometimes it can be a little bit challenging just because of the concerns related to other people's involvement and so on. And regardless, even if you're not directly involved in their treatment, encourage that open communication and that conversation. Be there and ask them, how can I support you? What do you need from me? And just be there. And don't give up, because when people are depressed, they tend to shut people off. They might not be ready to talk about it just yet. So be willing to be there when they're ready to open up and listen on ways that you can be supportive.
I think it can be challenging because parents, spouses, those close to people struggling might want to just kind of do it for them. So that's the other thing I would say is, being involved and trying to talk with the treatment providers so that they can be involved in a helpful way, and also understanding that for somebody to improve, it's kind of, they have to go through these steps themselves, and there's not really a shortcut that we can do for people, even though we want to, other than really supporting them and helping them along their journey in treatment.
Thank you. And I told a little lie. We got one more question that just came in. So with a teen who is not engaging in social activities, is it recommended to push them?
Yeah, that's a tough one, because you want to encourage, but you're also wanting to find that fine line of not pushing them too much, because if you do push them too much, then they might feel even more stressed and want to avoid even more and not be able to engage in that specific social activity that you would like for them to do. One question that I like to encourage parents to ask their kids, or even sometimes I ask some of the patients I work with too, is, if you cannot do this right now, what can you do instead? So can we find an easier starting point of going to this party is really hard right now. What can we do? Can we go out and get ice cream? Can we go out and just take a walk? Things like that. So we want to start small and then gradually increase the difficulties of activities that they had previously avoided to get them back on the momentum again.
That's very helpful. Thank you. All right, so that's all the time we have for today. Thank you so much for joining us and for sending in your questions. We hope this was helpful in learning more about depression. Thank you, Dr. Leonard and Dr. Tan, so much for your time and your insights. Dr. Tan, I think I'm going to use that GLAD mindfulness technique at home tonight, so thank you. If we did not get to your question, or you have any additional questions that may come up, feel free to send them via direct message to our Rogers Facebook page. And for more information on mental health and addiction treatment and resources at Rogers, visit rogersbh.org. Thanks again, and stay well.